Good morning. Welcome to the United Way of Southeast Louisiana's Public Policy Educational Session 1. This session will focus on education and health. I am Dr. Toya Barnes-Teamer, and I have the honor of serving as chair of United Way of Southeast Louisiana's Public Policy Committee. In my private life, I'm owner of the Teamer Strategy Group, LLC. I will be your host for today's program, and as we get started, I'd like to clarify a few housekeeping rules. This session will be recorded and shared with all registrants. There will be time for questions and discussion at the end of the program. Please share your questions using the chat. I would like to thank all participants for joining with us today. You may ask, why are we hosting these sessions? Every year, United Way of Southeast Louisiana creates an agenda outlining our priority public policy issues in health, education, financial stability, and community strengthening in preparation for the start of each state legislative session. United Way's legislative session agenda advances our fight to eradicate poverty in Southeast Louisiana through our Blueprint for Prosperity by supporting ALICE, asset-limited, income-constrained employed households. We focus strongly on public policy because it is one of the most effective ways to drive the system-level change our community so desperately needs. These educational sessions allow our public policy committee to gain insight from experts on key public policy issues and develop a comprehensive legislative agenda. We also collected information on the legislative priorities of United Way's community impact partners, who provide critical on-the-ground services to vulnerable populations across Southeast Louisiana. It is now my great honor to welcome today's esteemed panelists. Karen E. Powell with the Louisiana Department of Education, Sadie Becnel with the Louisiana Policy Institute for Children, Dr. Tristan Denley with the Louisiana Board of Regents, Secretary Michael Harrington with the Louisiana Department of Health, Jeanie Donovan with the New Orleans Health Department, Liz Skilton with Blanco Center, Louisiana Department of Health Statewide Whole Health Louisiana program. I'm now pleased to introduce to you Michael Williamson, President and CEO of the United Way of Southeast Louisiana. Michael will frame today's presentation by providing you an overview of the ALICE households in Southeast Louisiana. Please join me in welcoming Michael Williamson.
Well, good morning, and thank you, Toya, for that warm introduction, and good morning to all of you. So let me more formally introduce you to ALICE, if you don't know ALICE. And I'll start with ALICE as an acronym for Asset Limited, Income Constrained, Yet Employed. And these are households that work hard every day trying to achieve the American dream. We often say you might have a friend or a coworker is ALICE, or if you're like me at some point in your life, you were ALICE. And so you may have your own very real experience. These are often cashiers, waiters, childcare providers, and other members of our essential workforce. And ALICE earns just above the federal poverty level, but less than what it costs to make ends meet. And when households can't afford the basics, they're forced to make really difficult choices and trade-offs every day. The possible decisions like whether to pay for prescriptions or to keep enough food on the table. The larger gap that we've seen between income and expenses, the more extreme those decisions are, and the greater the risk to the family's immediate health, safety, and financial stability. And we all know financial hardship not only affects individuals and families, but it also has a negative impact economically and socially on our wider community. ALICE also represents the data reshaping the dialogue on financial hardship, and a grassroots movement that is picking up steam across half the United States and counting. More than 33 states across the U.S. are now ALICE report states. But unfortunately, Louisiana had the second highest ALICE rate in the nation, with 51% of households living below the ALICE threshold, only behind Mississippi. Let's talk a little more about ALICE in Louisiana. And over time, 3 trends are increasing. Let's talk about increasing cost. A family of 4 with 2 children in child care, their survival budget increased from $66,288 annually to $78,744 annually. And that was from 2021 to 2022, a significant increase. At the same time, we saw waning public assistance. The same family of 4 was eligible for approximately $15,000 less in federal tax credits and stimulus payments. And we saw modest wage increases as the pandemic assistance wound down. Wages increased for most low-wage jobs, but not enough to move them above the ALICE threshold. I also want to point out, for the purpose of this discussion today, the new ALICE legislative district tool. ALICE households make up a significant portion of the voting population in every legislative district, yet traditional measures of poverty often fail to capture their struggles. The ALICE legislative district tool provides a clearer, more accurate picture of the financial hardship at the local level, helping our policymakers understand the realities their constituents face. ALICE households, ALICE families are voters. They work in essential industries, they pay taxes and contribute to our economy. Their voices matter, and this tool helps to ensure that their challenges are front and center in policy discussions, which we can all admit today is far more important than ever. So we encourage you to use this data to engage with elected officials, providing them with the district-specific insights, illustrate how many households are struggling just to make ends meet. We all know policy decisions impact ALICE families every day, from access to affordable health care and child care to fair wages and housing policies. Lawmakers need to understand how their choices affect working families in their districts. Now, what can we all do? Let's talk about actions that you can undertake in support of ALICE. Taking action for ALICE means identifying the barriers, whether race, ethnicity, age, sex, gender identity, sexual orientation, zip code, health, ability, veteran status, or immigration status, that limit financial stability, and working towards solutions that remove those obstacles so all people can fully participate in our economy and society. This series that you're participating in today is about moving from education to action. We're committed not just to recognizing how structural inequities impact households, but actively addressing those challenges by doing a few things. First, using data to drive real change. Second, holding ourselves accountable to prioritizing solutions that center ALICE households and calling out actions that fail to support working families. 3, building a stronger network of partners by increasing collaboration across sectors and ensuring diverse voices are included in decision-making without overburdening those most affected by these issues. And advocating, which we can all do with action. We provide research and data to drive solutions that lift ALICE families out of financial hardship, while also challenging the policies and systems that keep people from getting ahead. The ultimate goal is simple: ensuring every ALICE household has the opportunity to live, work, and thrive in today's economy. Thank you again for being with us today. I look forward to hearing the discussion.
Thank you, Michael. It is now my pleasure to present to you our first panelist for today's program. Ms. Karen E. Powell is Deputy Assistant Superintendent for Early Childhood Care and Education at the Louisiana Department of Education, where she helps direct policy development and program implementation. Karen is dedicated to ensuring that children from birth to age 5 and their caregivers are supported so that our littlest learners achieve happy, healthy, successful futures in school and beyond. Please join me in welcoming Karen.
Thank you so much for having me here today. I look forward to sharing some goals and achievements of the Louisiana Department of Education. You can go to the next slide. So I wanted to make sure that we shared with you our department's education priorities. So it really starts with the foundation that early childhood leads to kindergarten readiness, and that we're ensuring that there are positive, effective early childhood experiences that our children are having. You can also see that we have a focus on literacy and math. Literacy instruction aligned to the science of reading, and math instruction from foundational to advanced skills, because we know that these are just fundamental critical skills that will ensure student success throughout school and beyond. Opportunities ensuring a meaningful high school experience, an effective teacher for every student, and to expand educational choice for students and families. So I'll talk next specifically about our early childhood achievements and goals. I am very, very pleased to note that in our most recent performance profiles for the state, these are ratings of every early childhood classroom in the state that receives public funding. More than 95% of these sites are now rated as proficient or higher. And I just want to note for you that when the early childhood accountability system began in 2016-17, this number was at 68%. So we have really seen tremendous work by the field to continue to improve the quality of care and education for young children. You can also see that, as you may know, we have separate assessments for pre-K classrooms, toddler classrooms, and infant classrooms. And so you can see that on pre-K classrooms, there have been continued steady incremental progress across all domains assessed. And you see that there is also increase in that instructional support, which is the most instructional component of the class tool. And you can see that same steady incremental growth across all domains of the toddler and the infant tools as well. So we're very proud of this ongoing improvement, but we are not finished. And very proud that you can see that that improvement is in every site type. So whether it's private childcare, early Head Start, or school-based settings, you can see that continuous quality improvement over time. So to continue to increase our performance and have children better prepared for success in school and beyond, we are now focusing on improving and increasing the number of high proficient and excellent sites. And in alignment with those LDOE educational priorities, we are really going to be zooming in on language development because language development is critical for literacy development. So these are just some of the key endeavors we have for early childhood to increase language development, provide targeted professional development opportunities, build further pathways for professionals to enter and grow, develop and strengthen early childhood teachers and retain them, streamline processes and operations, utilize data to identify highest needs and improve low-performing sites, expand developmental screenings, work on exploring other successful models with other state agencies, diversify strategies for childcare access, continue to partner with great local community organizations such as the United Way, engage families further, and further expand family childcare pathways. And I'll also share some of our K-12 achievements and goals. So extremely proud of our most recent scores in the nation's report card. All 50 states participate in this. It's measured every 2 years. And you can see on the next slide that our state, Louisiana's ranking has steadily and dramatically improved since 2013. So we are now in 2024 ranked 32 when we were previously ranked 49, 47, and 51. You can also see tremendous growth and improvement for fourth grade reading. Louisiana fourth graders are now #1 in the country for reading growth for the second consecutive cycle. You see that we're in the top 5 in the country for fourth grade math growth. You see that we are also continuing to improve 8th grade reading, and you'll see in the next slide, 8th grade math. And you'll note, as that last slide noted, we are one of the few states seeing these gains. So Louisiana was one of only 14 states to post gains in 8th grade math. And I'm also really proud to share that you see the same growth for students with disabilities, which is so critical. So whereas in other states, the average rate stayed the same or actually declined, in Louisiana, we are seeing growth for students with disabilities in 4th grade math, reading, and 8th grade math and reading. And we also scored very well on the Education Recovery Scoreboard. So again, in alignment with those priorities that I identified at the beginning of the presentation, we are really focused on improving literacy and math achievement in the state so that these students will be fully successful in school, but then also fully successful in their careers. So our role in legislative session really is to provide information and support. And so we look forward to providing data and answering questions from partners, stakeholders, legislators, and others in the upcoming session. Thank you so much.
Thank you, Karen. It is now my pleasure to introduce to you Sadie Becnel. Sadie is the Government Affairs Director and General Counsel at the Louisiana Policy Institute for Children. Before joining the Policy Institute, Sadie was the legislative liaison for the Louisiana Department of Children and Family Services. At DCFS, she served as liaison to the state legislators and their staff to provide updates on current department news and the liaison between the department, other state agencies, and budgetary agencies. Sadie?
Thank you, Dr. Barnes-Teamer, for that introduction. I am Sadie Becnel, and I'm going to tell you a little bit about the Louisiana Policy Institute for Children. We are a nonprofit, nonpartisan, independent source of research and data and information for policymakers as well as stakeholders regarding early childhood education for Louisiana's youngest learners, that is, children birth to 4, and their families. We seek to advance policies that ensure young children are prepared for success, not only in school, but also in life. And with that being said, the Ready Louisiana Coalition is a bipartisan group of over 180 organizations. I'm gonna let that sink in for a bit. 180 organizations, that is a lot. We have grown tremendously over the years. And those organizations include chambers of commerce, civic organizations, businesses, and advocacy organizations representing more than 1 million people in the Louisiana workforce. Now, the coalition's existence is based on the sole purpose of advocating for increased access to high-quality early childhood education and care. Our membership believes that investing in high-quality early childhood care and education will enable parents to be productive in the workforce, serving as an economic engine for communities, and prepare our youngest learners for a smart start in life. Next slide, please. Now, this coalition was not built overnight. This took years of groundwork The years of groundwork led to the formation of the Ready Louisiana Coalition in 2018 by the United Way of Southeast Louisiana, the Louisiana Policy Institute for Children, the Louisiana Association of United Ways, and the Jefferson Chamber of Commerce. And the coalition was formed not only to mobilize business leaders, advocates, and other organizations behind increased investment in high-quality early childhood care and education, but it's also to bring early childhood care and education into the mainstream conversation and ensure that it's a priority issue for legislators, in that we need to educate lawmakers, media, and public on what quality early childhood care and education looks like and why access is crucial for our economy. So now that I've given you a little history, I'm going to talk about our legislative priorities. One of our top priorities is to appropriate at least $30 million to the Louisiana Early Childhood Education Fund. This fund is set up to provide a dollar-for-dollar match to local investments in the early childhood care and education to specifically expand access to our most underserved population, which is birth to 3-year-olds. This fund is strictly for the locals to invest in their local municipality. And with that being said, the dollar-for-dollar match is the state investment matching whatever the locals put in. So that's to encourage the local to incentivize them. Secondly, our second priority is to invest at least $87.8 million in the Child Care Assistance Program, also known as CCAP. This program provides working families across the state with access to affordable, quality early childhood care and education programs, which was recommended by a bipartisan 2024 Louisiana Early Childhood Care and Education Commission. And lastly, we are seeking to ensure that the maintenance of $103.4 million in total funding for state pre-K programs for 4-year-olds, including LA4, non-public school early childhood development programs between the state and federal TANF funding sources to maintain seats for approximately 17,700 children. And lastly, something to note that's not on this presentation. A lot of you may be aware that this past fall, there was a tax special session. And in that tax special session, there was a constitutional amendment that was passed by the legislature that will eliminate the Education Excellence Fund, as well as the 8G block grant. Should this amendment pass a vote of the people on March 29th, the funds will be banished. This is important to us because many school districts rely on the Education Excellence Fund and the 8G funds to support quality pre-K programs for at-risk 4-year-olds, benefiting approximately 2,000 children. If these children lose their seats, their parents could face significant challenges in participating in the workforce. What that would look like? Arriving late, frequently absent, or even worse, having to quit their job altogether. Now, our goal in this session and our last legislative priority that I'm going to discuss, we're going to ask the administration as well as the legislature to work to secure new funding to fill that gap, should that pass, because it's so important to the workforce and the economy. So I thank you guys for listening today.
Thank you, Sadie. It is now my honor to introduce to you Dr. Tristan Denley. Dr. Denley currently serves as Deputy Commissioner for Academic Affairs and Innovation at the Louisiana Board of Regents, where he leads transformative efforts to improve student success across Louisiana. Since joining the board in 2022, he has spearheaded initiatives like Momentum, a comprehensive statewide framework for aligning higher education with workforce demands and enhancing college completion. Please join me in welcoming Dr. Denley.
Well, thanks so much. It's great to see everybody today. Yeah, so let me tell you some things about what it is that the Louisiana Board of Regents has been up to, and what are some of the priorities that we have for the upcoming legislative session. So first of all, maybe it's a good idea to just know who the Board of Regents is. So we work with all of the 28 universities, public universities and colleges here in the state of Louisiana. We work with all 4 of the management board systems, and so just as Toya said, we really try to champion success in college, enabling many more of Louisiana's residents to have educational attainment, because we know what a key that is to ongoing prosperity, especially for the folk that we've been talking about all morning. So we have a goal that by 2030, 60% of our adult population will have some kind of credential value past high school. And I think it's really important to realize that we are now no longer only talking about credentials that begin with D, degrees, diplomas. We are also talking about a whole bunch of credentials that begin with C, like certificates and short-term workforce credentials and certifications, because the reality is we need all of those kinds of credentials. We know that those that today, in today's economy, we know that in fact actually the future is already here. That last year, 68% of the jobs that were advertised in the state of Louisiana already were asking for more more educational attainment than a high school diploma. And so this work is really important to make sure that people actually earn the credentials that they need to be part of the economy today and to have a living and sustaining wage for them and their families. So with that, let me talk a little bit about some of the legislative priorities that we have coming up in the coming session. Of course, part of this is making sure that there is sufficient funding for different aspects of higher education. Not going to surprise you that in the end, money is a really important aspect of this. We in Louisiana for really more than a decade now have had a funding formula to distribute funds that have been provided by the state to all of our 28 universities and colleges. That funding formula over the years has really shifted from originally just a funding formula was really about where the students were enrolled to now increasingly about looking for ways in which we can reward institutions for outcomes for actually completing and graduating those students. And so actually quite recently at our just earlier in the spring, our board approved a brand new version of that formula. We do that once every 5 years. And the new formula is probably across the country the most aligned with the Louisiana economy. So it is now the case that the formula that we have really does support and reward institutions for graduating students with credentials that lead to high demand, high wage jobs. That's what we want to do. We want to make sure that when we get to that 60% goal, that it isn't just the case that people have something, they actually have the credentials that they need and that employers need them to have. And so we want to make sure that there is that really careful alignment between the portfolio of degrees and credentials that our institutions offer and the demands that Louisiana's economy has. And so in so many ways, we are very thankful that the governor has recommended a flat budget for us. I think we all knew that was not the way things were only about a few months ago, and so we're certainly very grateful that that's the position that we are in. But we do certainly want to make the case that investing in higher education is an investment in the communities and citizens of this state, both now and in the future. And so ways in which now we can utilize this formula to, as I say, literally support and reward institutions for doing exactly what we want them to do, graduate students with the credentials that they need to lead to a prosperous Louisiana. That's exactly what we want to do. Similarly around funding, so I was just the discussion about the ALICE framework couldn't have been better. I know all of you are very aware of the MJ Foster Promise program, which is specifically focused exactly at trying to help people who are largely below the ALICE threshold to earn the credentials that they need to transform their lives. What I'm happy to tell you is that program is really working. That in last year, we supported around 3,000 students. This year, we've already supported around 4,700 students. And and in fact, are just about exhausting all of the funds that are available in that program. And so this year, we will be asking the legislature to double the support for the MJ Foster program. It is right now at $10.5 million and has been since its inception. We're asking that would increase this year to $21 million. And really, the proof is in the pudding. That what we see is that when people graduate through that program, that it is transformative for them and their families. That 70% of the people who are supported by the MJ Foster Promise program, when they begin the program, are below the ALICE threshold. After they finish the program, 70% are above the ALICE threshold. They increase their family income by more than $20,000. It is utterly transformative to them and to their communities and to their families. And so I hope it will be the case that the impact of this program will be evident to legislators. And I mean that they were visionary in creating it. We want to make sure that they really see the fruit of the investments that they're making. Similarly, to try to reach the goal that we want to reach, we have to try to increase college going. In this state, college going has been on a sort of a steady decline for about a decade, both for returning adults, but also for students right out of high school. And so for the last few years, we have really tried to double down on all kinds of work to help many more students begin college in high school, be part of dual enrollment and early college kinds of experiences. And what I'm happy to tell you is that strategy is really working. So first of all, we have seen 3 years in a row, double-digit percentage increases in the numbers of students who have been part of dual enrollment, very substantial increases for African-American students across the state. And what I'm happy to tell you is that, as I say, that strategy is working. For the first time this year, we actually did see that college going rate right out of high school increased by actually about 3%. So we actually put ourselves back to the same rate that we were before COVID back in 2019. So a real turnaround of the hockey stick, which is really exciting. And all of the evidence that we have seems to suggest that, no, 1 point is not a trend. I'm not pretending that it is, but there's every reason to imagine that we will see that increase because of the strategies that we're doing. Now, I'm sure that you know that as things currently stand across the state, dual enrollment, we don't have funds specifically to enable people to take dual enrollment courses. The picture for funding dual enrollment is very mixed across the state. In some schools, the school pays for it all, and some other schools, the school doesn't pay it all, and it's all on the parents, and some mixture of the two. What we have been asking for several years now is dedicated funds from the legislature to enable all Louisiana's students in their junior and senior year to have the ability to take a dual enrollment course for free. And so, again, we will be asking for funding from that. So just in the last couple of minutes, I'll talk about some other policy-based things that I think are just also very important. So first of all, just about a month ago, I wrapped up a complete overview of the state's financial aid policies. As you might know, we have TOPS and MJ Foster and the GO grants and actually a dizzying array of different financial aid tools, but they were all kind of created across about a 30-year time span. They all have different rules. They all have different ways of operating, and they don't really mix together particularly well because of the way in which they were created. And so this report really makes some common sense recommendations to change the way that some of our financial aid tools work to enable them to really work together in a more effective way, to be able to make the top scholarship be much more competitive in keeping the best and brightest here in the state of Louisiana, and also to be able to create many more sort of eligibility pathways, for instance, using ideas like dual enrollment or CTE as ways in which students could demonstrate that they should be eligible for TOPS or TOPS Tech. And so we, as part of that report, there are a number of recommendations in the field of financial aid, and certainly there is some interest among several legislators about championing some of those changes, and certainly very happy to work with them as we work our way through the session. Then the last piece is around really strengthening the alignment with our workforce, because the reality is, I think we all know, it's all very well for students to graduate with credentials here in Louisiana, but we really benefit when they actually stay in Louisiana and build a life here. We don't want them to graduate and then go off and leave. And so there are a number of strategies that we're really looking to do to try to enable and build a specific and intentional career counseling strategy in college right from the very start, not as an afterthought, not in the spring of your graduating year, but instead right from the very start, putting in place best practices that really engage students with that thinking about how it is that they can engage with where it is that they're headed, and also really, for instance, making available labor market data, and also really opening up the possibilities of them doing internships, apprenticeships, clinical placements, all kinds of work-based learning. We know that creating those networks are exactly the ways in which we'll be able to help students make the connections while they're in college and then stay in Louisiana after graduation. Yeah, so thanks so much.
Thank you, Tristan. Now I'm excited to introduce our next panelist, Secretary Michael Harrington, who served as former CEO, COO of Adult, Pediatric, Tertiary, and Community Health Services, including post-acute services. With over 30 years of service in for-profit and not-for-profit health systems, his passion is developing reliable processes that engage people, process, technology, and culture to grow patient safety and financial viability. Please join me in welcoming Secretary Harrington.
Good morning.
Morning.
I want to thank you for this opportunity. I came, it's a little over a year now, January 8th, with the governor. I was recruited by a group of physicians in North Louisiana. I was actually here with Tristan's Health from like 2012 to 16, and I got recruited to go take the CEO role of a large 300-bed tertiary pediatric teaching hospital in Miami, which was just something that I couldn't turn down. I really had a phenomenal time doing that. But let me just, this morning, I'm going to talk about a couple of things, in particular the SHIP program, which we have posted. Please know that that is available on our LDH website. I'm going to talk to some very specific categories out of that. But that program overall, we are using it as a true roadmap. As a hospital CEO, I'm used to having dashboards and being able to track and know whether you're on task or not. As you know, this particular session is going to be a financial session. So, of course, a lot of our policies are going to be very much focused on looking at how to reinforce not just funding, but outcomes as it relates to the SHIP program itself. As you know, in Louisiana, I was so excited to see the educational trends because unfortunately, the last 5-10 years of that same looking trend for healthcare in terms of population health is unfortunately very flat. It's in that 48-50 type range in terms of our rankings. And so when you look across a lot of different indicators, we're spending incredible amounts of money. This year, we're proposing a $21.4 billion budget for LDH. Now, that includes a lot of our supplementals and other kinds of services. 71% of that is federal dollars in terms of Medicaid. Of course, the largest program overall in that is Medicaid and the MCOs. But it's a significant amount. So the Surgeon General and I, as you know, that position, the Surgeon General was created last session with that focus between the two of us really about policy and finance and operations to be able to continue to look at how do we take the dollars that we have and be able to get better outcomes. And when you think about the SHIP, we really have to think about how to create innovation. I mean, we have to think about, we've been doing healthcare the same old way we've been doing it a long time. They're not saying that that doesn't have some value, but when you think about population health, and I'll identify some of those key areas here in a minute, we have to be able to think about how to inspire innovation. And I'll talk about a couple of key things we're doing around that at the end. But when we think about the SHIP, we have really 4 key categories. Behavioral health, as you know, is a primary focus. And certainly we know that that is a focus of the governor. Certainly something, excuse me, that we are very much aligned on. Chronic disease, certainly one of the things we see within our Medicaid population as it continues to age is the amount of chronic disease in terms of COPD or diabetes. I mean, those congestive heart failure, those are the kind of things that we're focused on being able to see how can we actually treat at home keep people in their current residence rather than bouncing in and out of the hospital. Maternal fetal, child health is another key focus that you'll see in the SHIP in terms of the plan. And then the other one, and a lot of times people don't, I think, give enough credit. I think the governor had great insight into why this is so important, but that is in community safety. There's some key things that we are, on the behavioral health, and I'll go through just a couple of the kind of key highlights for each of these areas in terms of key things that we're looking at. But when you're thinking about mental health, you're facing 1 in 3 in terms of people in the United States. This is a critical issue. It impacts education, certainly impacts homes, it impacts work. There's lots of things there in terms of how that impacts, the community as a whole. Now, one of the key things that we've focused on is access. It's one thing in Medicaid to have coverage. It's another thing to have access. And certainly when you think about mental health, one of the things that we did last year was that we got a provision where there are almost 4,000 provisional licensed professionals in Louisiana that were not able to access Medicaid. And so we got approval to be able to have them access and get paid in terms of Medicaid services. So we think that created a much different access point than what we had before. Because again, this is something that we know that we have to be able to continue to improve in terms of access and the numbers. We also looked at the trained, recognized peer support specialist. It's actually one of the bills that we also have this year in this fiscal year, where this is such a important area, increasing the number of Louisiana trained mental health first, basically from about 5,600 per 100,000 in 23 to 7,100 or more in terms of 100,000 in 24. So we want to be able to make sure that these peer programs in terms of support are available and that the people who are actually providing it have the kind of training and credentialing and some baseline type of services. So we have some sense about that predictability and certainly the interaction. One of the key things also that we talked about, currently, if you think about the number of people, it's about 524 to basically practitioners. We wanted to try to reduce that down to 477. I'm very pleased to say that with some of the changes we made on the provisional and access, we're actually at 480 per practitioner, down from that 577. Now, the other key thing that we have seen in terms of Louisiana is the rise, certainly of fentanyl and the isolation of people experienced during this pandemic. We saw a 67% increase in opioid overdose deaths in 2020. And that trend overall, from what we're seeing, basically has continued. There was a 40% increase in 2021. So that is an area also when we have some of our bills that are coming up in this session that we're focusing on access and certainly materials and supplies, those kind of services to make sure that, again, that people have access. There's also a Louisiana crisis response system that we've developed that you would see in the plan itself as a way to support services more in a community-based fashion than perhaps what we have before. There's also an interesting program. We actually submitted this last fall. It's called 1115 waiver. There's a few other states that have done this, and the purpose of it is to be able to have, before when someone is in corrections, that 90 days before they are basically discharged, that we're able to go in and do case management with them. We're able to help them with work or supplies, jobs, whatever it is, housing, that you're able to help them from a case management 90 days before they leave, so that when they hit that transition period, it's not just basically recycling in terms of recidivism or creating other opportunities for them in terms of, crimes and things like that. It really is wanting to set up a different process. And a lot of this has to do with making sure they have that peer support. They have those kind of supplies and supports in terms of dealing with issues around substance abuse or other kind of services. So we know that this is going to be a substantial change. And we're really glad to be able to see that CMS supported us in terms of this waiver around this particular program. Now, chronic disease. They're one of the key things that we're looking at, and this is something that's related. We have a bill that we're working on right now called SB 190. And the issue for Medicaid is, and this is one of the key things we've been sharing with the legislators. It's one thing to have coverage, it's another thing to have access. And those two are very, very different. And I know we like to talk about, we have all these people that have coverage, but when you think about access in terms of Medicaid, trying to get someone to see an endocrinologist, a neurologist, orthopedic, all those kind of specialists, and even the primary care physicians will tell you, pediatricians, they limit the number of people because in their practices, because they can't be able to get them referred when they're needed to specialists. And the key, I think, part of that is the fact that our fee schedule on the Medicaid side for physicians has not been touched in over 15 years. So our proposal, without utilizing state general funds, is to be able to have this first year, it'll be a 2-year program, to be able to have them come to 85% of Medicare fee schedule, the second year to be able to come to 100% of the Medicare fee schedule. And the reason for that, certainly as a hospital CEO, I never saw specialists turning down Medicare type of patients. They were certainly willing to take them in terms of their practice. So we're working with the legislators to be able to get that SB 190. Senator Boudreaux is the one who's really supporting that. That also will help somewhat of the increase for the mid-levels as well, because typically they're billing off of that physician fee schedule. So we know that access and checkups and routine type services for that chronic population is essential. And we believe that being able to increase that fee schedule will be essential to be able to do that. There's lots of other, you'll see projects and things. I'm trying to be cognizant of time here within maternal health. So please, if you'll take a look at that SHIP on the website, you'll see there's lots of things there. The other one, maternal health. And the Louisiana Perinatal Quality Collaborative partnered with them and looking at how to create those services across the state. One of the things we're also working with is that Women's Hospital within Louisiana, I think, has a lot of programs and services that we would like to be able to see scaled across the state. And so we are working with them. I know they have a project going on right now, taking a lot of their outcomes that are well at the standards of what we would want to see that are identified within the SHIP, and being able to transport those, translate those into other communities. They have a very active program going on right now with Opelousas, for instance, around this very specific issue of maternal health and being able to develop those programs and services. So this is another key priority for us. Again, preterm births, I mean, you're running about 13.5%. It's one of the reasons why we're at that, either 48th or 50th particularly. Our goal is to, it doesn't sound like much, but getting it to 12% would make a huge difference. As I said, in terms of Women's Hospital, they're already at that and typically are doing better. And they do see a tremendous amount. I mean, Medicaid is about 60% of the total births within the state. The other thing we're doing is partnering, which again, one of the things the Surgeon General and I have looked at is how can we align the overall outcomes across the state. And so one of the things we've done is, and we're actively working with Blue Cross, believe it or not, because they very much share a lot of the same issues around maternal health. So what we're saying is, let's work with the physicians, the programs, the hospitals to have the same outcome indicators as priority. so that we're working together to reinforce across. Because if you look at Blue Cross and Medicaid, you're probably looking at 85% or more of the total births. So we're looking at how to collaborate to basically identify those outcomes and have the consistency in terms of those services as well. Now, the other one, we did get an interesting grant. This is a 10-year grant. It's not a lot of money every year. It's about 1.7 million, but it is substantial. It's around basically what's called the TAM. This was a Medicaid services program. We're one of 15 states that actually was awarded this. And the goal is to reduce disparities in access and treatment. That's the whole purpose of this particular grant that we've been able to receive. So we know that this will also have an impact. Community safety, again, you'll see in the SHIP, over 50% of Louisianans, when we did this assessment in developing this SHIP, identified reliable public transportation, affordable housing, and violence as major issues jeopardizing public safety and therefore in terms of health. And so, as you know, the governor, we're very much focused on crime, mental health, and how those integrate to each other for being able to provide appropriate treatment. The other issue that we are looking at, and this is something where I was going to ask previously when we were looking at some of those slides, is the proportion of adolescent and young adults who aren't in school or working. And basically, what we see is about 16.7% is currently. And so now our most recent data is showing that that's trending somewhat in the right direction. It's about 15%, but we still think that's a substantial number when you think about the number of adolescents and young adults in that kind of situation and what that means. Now, I'll just highlight a couple of key things that we have done. We actually, the legislators moved the HERO Fund to us last year. The HERO Fund is about a $15 million project. It's about basically healthcare employment, reinvestment. It's opportunity fund. What's interesting is that we've really been able to kick this program off and really develop it to the point where by the January 31 deadline this year, we received more than 100 applications that equated. We got about 15 million, but unfortunately, the total funding that was being requested was only 69.5. So we're in the process of trying to, unfortunately, having to, of course, scale that down to be able to get some of these programs and get these things in place. But it's a very active program. We know it will have some really impact. So we look forward to being able to partner with people in the community. The other one I'd like to share with you project that I think is an incredibly innovative project. And this is one of the things coming from the hospital environment is that I think we have to make sure we have a continuum of care. Hospitals will always play a role, but we need to be highly focused this day and time on outpatient and being able to treat people in their home. One of the things that I started looking at is certainly around recidivism within Medicaid in our population, but also looking at the number of people and how often they are using the emergency department. Rather than using their primary care practice, they're using the emergency department as essentially their care center. And the irony is that we found that 20% of the state's Medicaid patients, they're going to visit the emergency room on an average of 17 times a year. Now, the purpose of this pilot project in Regions 4 and 5 that we have going on right now is that what we're looking at there is actually treating in the home. So rather than the person, if it's a diabetic, we've had some great stories already since we started this pilot project for about 6 months, where rather than going to the ED, we're actually having and partnering with a KDN ambulance where they're actually treating in the home. And then also providing, there's actually a resource where you can get case management as part of that as well. So we have physician practices, we have hospitals that are actually sending us people that are high priority in terms of it. we have people who, this was an average, we have people who use the ED 40, 50 times a year. And that's just that revolving door and not getting any kind of real stabilization. So we think that out of this pilot, we're going to learn a lot to be able to, and there's some states have actually taken this concept of treat at home and actually integrated into the 911 process, because probably 40% of those 911 calls are things that can be done at home. And of course, the patient always has a choice, but it's the kind of things that innovation, and we talked about designing work differently, are the kind of things we're going to do. So I'm sorry if I went a little long, but we have it's a big, big department, as you know, and we got a lot of things going on and a lot of things we want to be able to share. But the key thing that I really appreciated this morning was the opportunity to be able to see how we can continue to work together, because to really change the systemic issues that we're facing that have been here for 10, 15 years when it comes to population health and these, it's really going to take an overall systemic change, and that's going to come about by people working together. And that's why we're reaching out to Blue Cross, which they say hasn't been done in years and years, or reaching to a women's hospital to say, let's look at how we can scale these services. So one, I want to thank you for your work and for the opportunity to be able to meet many of you this morning, even if it's virtually, and see the things you're doing and how we can continue to work together to build the health, certainly, of the state of Louisiana. Thank you.
Thank you, Secretary Harrington. You know, I'm excited too in listening to what you had to share, and also kind of putting the puzzle pieces together when we talk about early child care, when we talk about, you know, post-secondary education, when we talk about how education impacts healthcare, but also workforce and economic development. So one of the points Karen made in the chat was, you know, the point about the growth in chronic absenteeism, with students missing more than 10% of days in a school year, and how that slowed down recovery in many districts in Louisiana. And as a board member for the United Way, I'm proud to say that the United Way served as the community engagement and stakeholder outreach partner to Healthy State Louisiana for their South Shore Community Health Needs Assessment. So I really do appreciate how we are integrating, you know, all of these areas. And so it really does help us with trying to set up a comprehensive policy agenda for the United Way. So thank you again. I'm sorry.
I could just comment about one other component that where we're working together, and it has to do with school-based mental health and actually comprehensive case management services in school-based programs. We've got some pilots. In fact, we're headed to Faraday School System this Friday to look at how we can actually integrate that. Well, again, working together with DCFS and the local school, what they have a STAR program, and the MCOs to then integrate to have those very comprehensive school-based services and programs. And one of the things we would target, of course, are those children who are basically in that absenteeism, because they're coming some, but there's got to be some other things that impact them. So that's another thing and a key initiative we have going on.
Thank you so much. Thank you. And now it's my privilege to welcome Jeanie Donovan. Ms. Donovan serves as the Deputy Director of Population Health and Disease Prevention at the New Orleans Health Department, where she manages strategic policy and programmatic initiatives aimed at improving population health outcomes in New Orleans. Please join me in welcoming Jeanie to today's program.
Thanks, Dr. Barnes team. We're excited to be here with all of you. And I'm going to go ahead and share my slides so everyone can see them. Can you see those? All right, great. I think I'm going to switch. There we go. Is that better?
Yes.
Okay, great. Well, as Dr. Barnes-Teamer said, I'm Jeanie Donovan. I'm Deputy Director at the New Orleans Health Department. And just a little bit of context about the health department following Secretary Harrington. So we are an independent local health department. We are the only local health department in the state of Louisiana, just a fun fact. And we're actually a little bit older than the state health department. But we work extremely closely with LDH from the top on down across our programs and services, and we have a wonderful working relationship with them. And I'm excited to follow Secretary Harrington because you will hear a bit of overlap in our priorities and the issues that we're trying to address. First and foremost, Secretary Harrington mentioned the state's SHIP, which is the State Health Improvement Plan. We operate under a CHIP, a Community Health Improvement Plan, which is the local version of that. And so I bring this up because this is really the foundation of everything that we do, programs and policies at the health department. And it's based on surveys of the community. So every 5 years, we go out and ask our community and our partners, what are the issues that are standing in the way of health and you having the healthiest life that you can? And we base what we do on what we hear from those surveys. And the 3 big buckets that we operate under are increased access to care, improving economic stability, and ensuring community safety. So again, a lot of overlap from what you heard from the secretary and from other presenters this morning. Our base of individuals and organizations that work on this, work with us, is very broad and includes many of you on the call today. So I'll jump right into it. So this is just a list of the priorities that I'm going to walk through today for the state legislative session. I say we're about a month out from the session kicking off, and things are still fluid as always. So this isn't a hard and fast. There's still a couple things we're in discussion around, some things that may fall off the list, but this is where it looks like we're headed right now. And the first is, as Secretary Harrington said, protecting access to Medicaid. It is the foundation of our health system, and it does cover over a half of the Orleans population with health insurance coverage and nearly half of the regional population, as well as the state. So we know that there are some discussions at the federal level related to changes to Medicaid policy. They could have trickle-down impacts at the state level. So we're watching both of those conversations very closely to make sure that the state legislature is attuned to those federal policy conversations, and that any changes at the state level to account for federal changes keep access in mind and make sure that we're maximizing access for those who qualify for Medicaid, because we know it's vital. Many of those Alice families that Michael mentioned at the top of the call are relying on Medicaid. They're working families who can't quite afford employer-based coverage or are not offered employer-based coverage. And so this Medicaid coverage is vital to their economic stability and their health. And we also know it's vital to our economy. So the LDH released a report that $2.7 billion was invested in the greater New Orleans area. That's a 4-parish region in 2022 via Medicaid, and about 1.3 in Orleans Parish alone. And so we know this is a huge part of our healthcare system as well. Building on this Medicaid picture, one of our priorities will be supporting what Secretary Harrington said about increasing reimbursement rates for providers in Medicaid. We were very excited to see this included in the governor's FY26 budget. We did support SB 190 last session that Secretary Harrington mentioned, and we know that increasing rates for providers does increase provider participation and improved access to high quality services. In an actuarial report that was released, it showed that the state would spend $26 million more on improved access to care and $16 million less on emergency room care if rates were increased for providers. So this is speaking exactly to what the secretary touched on, trying to get people more into primary and specialty care and out of that emergency room care, which we know is costly and doesn't result in the long-term outcomes that we want to see. So really excited to support this investment in making Medicaid stronger and better, and not, like he said, not just giving coverage, but giving real access. The next priority, kind of shifting gears into more of a public health lane. When we think about chronic disease and what's driving chronic disease in Louisiana, smoking and nicotine use is a huge driver. We have higher than average rates of smoking, both at the state and local level. And we know that while we've seen some decreases in traditional tobacco use over the years, we're seeing a dramatic increase in the use of vapor and nicotine products among youth. And we know that youth who get addicted to nicotine will eventually transition to cigarettes, most likely, and that is a huge problem down the line for us. And so we're really working, we know this is a tax session, so this is the perfect time to have a tax conversation. We know that youth are particularly price sensitive, so if we increase that tax rate, our very low tax rate on nicotine products that we have now, if we increase that rate, we know that youth are going to be more likely to not buy or to be priced out of that market. And so we're working with a coalition to increase the rate of state taxation on tobacco and nicotine products this year. We're also working on increasing access to evidence-based postpartum home visiting programs. Some of you who live in the greater New Orleans area probably have read or heard about our Family Connects Universal Postpartum Home Visiting Program that we launched about 1.5 years ago in partnership with Ochsner and LCMC. There was a state task force that concluded its work about a month ago and released a very clear report chaired by Women's Hospital and Ochsner, actually, that showed that our home visiting program reduces costs and ED emergency department use and inpatient hospitalization by $3 for every dollar invested in the program, and that it improved health outcomes for moms and babies. I won't get into the details. There's several different studies that have shown the decrease in child protection services referrals, improved postpartum depression outcomes for mom, and increased breastfeeding rates for babies. And so the task force recommended statewide expansion of that program and to create sustainable funding mechanisms through Medicaid and private insurance coverage and reimbursement for those services. Currently, the city's pilot is entirely funded by the city, which limits the ability of other cities and locations in the state from being able to provide the program. So with a sustainable reimbursement mechanism, other states or cities like Women's Hospital, we've heard interest from Alexandria and Monroe, would be able to have a similar program and expand the pilot that we started here in Orleans. So we will be working on several policy priorities around those recommendations from the task force. We also will be working to protect access to evidence-based public health interventions. And there's two categories under this. One is vaccines. In the last 2 years, I went back and counted, there were 22 pieces of vaccine-related legislation. If I went back another year, it probably would have doubled. That first year coming out of the COVID pandemic, there were probably 24 instruments that were filed related to vaccines, both positive, pro-vaccine, anti-vaccine, or everything in between. So we know this is a hot topic with the state legislature, and we know this is now a hot topic at the federal level, and we know most alarmingly that we have childhood outbreaks of preventable virus diseases in our neighboring states. This is a huge concern for us in New Orleans. Should be a huge concern for everyone in the state. We do not want to see one child die in our state from a vaccine preventable disease. And what's most alarming is pulling off LDH's website yesterday, looking at these graphs or these maps on the bottom. From 2021 school year to the 2023 school year, we saw a decrease of 5 percentage points in the vaccination rate among youth in our schools. And we know the recommended vaccine level to keep outbreaks from occurring is 95%. And if I had gone, this is as far back as the state's website went, but if we went back even a couple of years before 2021, we were at or near that 95% vaccine rate for youth entering schools. And now we're down to 85%. It's extremely concerning. We will be working on any legislation that would further threaten vaccine access or vaccine information going out to families in our schools. And last, another evidence-based public health intervention that it looks like there will be a discussion about in the upcoming legislative session based on pre-filed bills is fluoride in public water systems. So we know that this is one of the top 10 public health achievements of the last century. Fluoridating water helps kids and families reduce cavities, saves money on healthcare bills. It results in fewer fillings and less days of missed work in school. We know if you have a toothache, it's something that will not allow you to learn or to work. And we know that there's discussion of the risks associated with fluoride, and we actually know that the people who are most at risk of excess fluoride exposure are people who have well water, not people who have public water systems, because public water systems are monitored daily for fluoride levels at the EPA level that's required or below. From LDH's guidance on community fluoridated water, it says it's cost effective. Every dollar spent on community water fluoridation saves $38 in future dental costs. And also in LDH's guidance, it says that each day at a location that is representative of distributed water. Every public water system that uses fluoride must be measured and recorded every single day. So we know there is not a risk of increasing fluoride levels without the public knowing, because if that is recorded above the level, they are required to notify the public. And that's the end. Also, before I close, I just want to say two other things that are on our sort of radar are also in the community safety realm around making sure that guns are stored safely is a conversation that we're having. That we had a local ordinance related to safe storage to prevent children from accessing weapons. That ordinance was preempted by a bill that was passed last session. So we're in early conversations with our legislature around recreating that law at the state level. We know that Texas and Florida have very similar laws that they put on the books in recent years to make sure that parents are storing guns safely and children don't get access to them. The other issue that we've worked on historically in coalition is around paid parental leave. We know that moms and parents who have access to parental leave after they deliver a baby have healthier outcomes and are more economically stable. And so that'll also be a priority if a bill is filed to support that.
Well, thank you, Jeanie. Thank you so much. And now it's my pleasure to introduce Liz Skilton. Ms. Skilton is an Associate Director of Research at the Blanco Center and head of the implementation team for the Louisiana Department of Health statewide Whole Health Louisiana program. With expertise in community engagement and historical research with a focus on Louisiana, environmental, trauma, and hazards history, in addition to qualitative research methods training. So welcome, Liz.
Thank you all. I'm really excited to be here. As mentioned, my specialty is technically in history, but I deal with trauma and disasters, and the Whole Health Louisiana program really is very close to my heart at the Blanco Center. As mentioned, I'm the head of this program for the implementation side of things from the Blanco Center, and we'll talk about our role in just a second here. But the Whole Health Louisiana program is Louisiana's statewide plan to systematically address the widespread issue of childhood adversity and trauma. And it looks like you all can see my screen now, which is great. The state plan developed over the course of about a year and a half, beginning with a statewide discovery process, a convening of state leaders, experts, and advocates to review the findings, and a year-long collaborative process to draft the state plan, which is now in its first year of implementation. The mission of the plan is to transform Louisiana's approach to cross-system collaboration and community-specific care so that together we can effectively prevent, recognize, and treat childhood adversity and its effects, allowing the people of Louisiana to access their full potential. Our vision is that children, families, and community members across Louisiana are healthy and thriving, regardless of who they are or where they live. We have 4 priority goals as part of the plan itself. The first one being collaboration, establishing and providing a foundational support for the plan itself and its implementation with the help of a coalition that works to kind of help implement this plan and come up with ideas for it. Awareness, promoting accuracy and widespread understanding across the state of the prevalence of childhood adversity, associated risk and protective factors, and actionable strategies that support prevention and mitigation. Prevention and healing is our third major theme, to increase buy-in and adoption of new and existing trauma-informed systems and services that enhance the prevention of and healing from childhood trauma for families and communities. And then our fourth and final major priority area and goal is to increase support for our workforce, both our current and future workforce, with a commitment to and investment in evidence-based and promising trauma-informed and culturally responsive practices within child and family serving entities across the systems in Louisiana. The Blanco Center for Public Policy at the University of Louisiana Lafayette was chosen last year in June to be the statewide lead for this program. We handle the implementation, the data analysis and gathering, and the evaluation of the plan over the course of its 5 years that it will be running through the state of Louisiana. And like I said, we are in year 1 of the plan, and that has included a lot of different activities so far. We have held regional trainings across the state to widen the growth and acceptance and practice of trauma-informed care practices. We hold a monthly Lunch and Learn webinar series on trauma-informed care and how it relates to specific workplaces or subjects that people are interested in. We meet bi-monthly with a coalition that helps inform and review the data that we are collecting across the state in reference to systems that are adversely impacted by trauma and the children and families that we seek to serve. And then we hold a semi-annual summit in October and April to kind of give an update on the plan's progress and an idea of where we're headed from there. In terms of what we've been able to achieve so far, we have completed trainings in all 9 areas of the state so far this year. We've had 173 different individuals trained in trauma-informed care practices and given out about 113 CEU credits with that. In terms of our Lunch and Learn series, we've had about 7 so far, and we have more to come. We've had about 224 webinar attendees, all receiving CEU credits as well as part of that. And our next webinar as part of the Lunch and Learn series is actually on next Thursday on March 20th. And it's interesting that Secretary Harrington was on the call earlier because the 2 individuals, Robert Hines and Kenyatta Royal, are going to be speaking at our webinar series, Lunch and Learn, next week on public health data and its use. And they'll be talking about the state health improvement plan that Secretary Harrington mentioned, the SHIP program or plan. So we're all very excited to hear about how that's influencing Louisiana and how it relates to the Whole Health Louisiana and the plan program itself. Overall, I would say that we're in our first year, we're just past the 6-month mark of implementation. We have had a lot of interest across the state, and it's only growing from here, which just really speaks to the desire, need, and want for trauma-informed care, trainings, support, funding, and resources so that we can better reach our communities and help those children who are adversely impacted as part of it. In terms of legislative priorities for the fiscal year 25, I was trying to think about this strategically because we're so early in this 5-year plan's implementation that we're really, I feel like, at the starting line. We have really good research that supports the need for this plan and the resources that would support it. But we're starting to kind of build the policy implementation or support that will kind of lead the plan forward in the future. So where we're at the starting ground is just continuing to build and support awareness of and for trauma-informed care practices throughout the state to address the widespread issue of childhood adversity and trauma. We're really working with organizations to increase training and support for trauma-informed care across the state. And we're looking to provide research to support policy development related to addressing childhood adversity and trauma. So I would say those are the 3 primary goals for where we're at right now. And we're really just looking to support organizations who are pushing forward initiatives related to this really important issue. If you are interested in being part of our coalition to kind of help support and grow this plan and its implementation, we certainly encourage people to sign up. You can do so using the QR code here or the Linktree link at the bottom, which will also lead you to signing up to the newsletter, the regional training information that comes for year 2, and our Lunch and Learn webinar series, such as the one next week on Thursday. And if you have any questions, you can always reach out to me or others at the Blanco Center. We are happy to answer them. And like I said, we're just really excited about the growth of this area and this plan and looking forward to what comes next and fully supportive of anything that anybody wants to recommend that can help our communities. So thank you very much.
Thank you, Liz. And I'm excited too, because as you talked about who your speakers are going to be, it just reminded me of the work that we were doing around BPP with the community of practice. And so now to see all of these pieces coming together is really exciting. And I'm just so happy that Tremaine asked me to be a part of this process. And I am seeing some questions. So we're going to open up today's program with questions that we are receiving via the chat. So I'll go to the first one that I see, which is Whole Health Louisiana seeking to offer funding for trauma-informed programs and services?
Yeah, I can answer this briefly. As we're looking to year 2 and what we're hoping to do, we are starting to pair up with different workplaces to bring trauma-informed training practices into those workplaces and really work to cater the trainings to be for a specific workplace. And so we have some funding that's connected to that to help us get to your workplace and to assist in training in trauma-informed care. In addition, we're applying for grants currently and have others that are in the queue as well to help better fund this sort of system as well. I would say if you're interested in funding or if in working with us in some way, just reach out. I'm happy to put you in touch with whomever on our team or to think strategically about ways to do that.
And where it looks like you, Liz, you have the next question too. But in the meantime, Jeanie, you had mentioned the HCR 113 task force report on home visitation. So we have someone asking if you could post that in the chat. But while you're looking to do that, the next question for you, Liz, is does Whole Health Louisiana have an evidence-based model they promote?
You know, Sarah, I can put a link to the plan itself in the chat so that you can take a look at the research that was done to support the program overall and the plan's initiatives. And then I will follow up with you separately as well, if that's okay. If you post your email or send it to Dr. Barnes' teamer, I'm happy to send more information that way.
Thanks, Liz. Any other questions? We have a couple minutes, and of course, I'm going to turn this over to Charmaine at some point before we get to the 11 o'clock hour. But are there any other questions for any of our panelists? All right, well, there's always an opportunity that if something comes up, as Liz mentioned, you can either, email us at the United Way and we can follow up on those questions or concerns with our panelists. Oh, wait, another question has come through. Does WHL program on trauma also apply to adults?
I think this is a great question. So as we've done the trainings, this issue just keeps coming up. The primary focus, I think, of the plan initially was to focus on children and families, right? So by extension, it does relate to adults, it relates to caregivers, it relates to those that are working with those children who are adversely impacted by trauma or other situations in the state. I think, as we look to grow the program, it will probably expand to kind of focus on this broad network of individuals that are connected to those children and families. And so I think there are a lot of ways for expansion here to do that.
Thanks, Liz. And I also want to mention that Jeanie has put in the chat the report for HCR 113 task force. And then there is another question, and that is, and it's directed, Dr. Harrington, to you. How can we support you and the department's efforts on higher Medicaid reimbursement rates?
And I assume that those rates are specific to SB 190, which is really our focus right now for access. It is primarily in the hands of the Senate Finance Committee. That'd be Chairman McMath, certainly Senator Boudreaux, who is the sponsor of it, Senator Presley, Luno, those legislators. Anything you can do to communicate to them this continued need to create access versus coverage. And I think, Jeanie, your slide about that whole reinforcement piece of access, that's the kind of information that I think they need to see from a community-wide basis. Certainly we're advocating, especially when it's not going to require state general funds to get this done.
Thank you, Dr. Harrington.
You can send it, to me. You can send it directly to them. Just any way in which you want to help provide and support that. But we greatly appreciate that.
Thank you. Well, not seeing any other questions in the chat and noticing we have 3 minutes, I do want to introduce who actually requires no introduction, Charmaine Cassiope, who serves as Executive Vice President and COO for the United Way of Southeast Louisiana's Public Policy and Governmental Affairs. Her 20-year career at United Way of Southeast Louisiana has included the successful advocating for the first ever EITC state match, passage of the child care tax credits, implementing statewide high-quality early child care rating system, a fierce champion in the fight against domestic violence, sexual assault, and human trafficking. She has fought tirelessly to secure state funding for Louisiana's 211 Information Referral and Crisis Management Service, early care and education, safe schools, paid family leave, and breast cancer survivor services. And I love to work with Charmaine because even though this is really hard work, it's very passionate work. And because of her passion, it makes it fun for all of us to just follow her and support her and do this work with her. So with no further ado, I want to turn this over to Charmaine Cassiope.
Well, thank you very much, Toya. I couldn't be more honored than to have had you this morning serve as our host with this incredibly informative public policy educational session. More importantly, thank you for taking on the responsibilities of bringing your level of passion and expertise to the United Way of Southeast Louisiana in chairing our Public Policy Committee, because I know so much of what we're advocating for has been work you've dedicated yourself to for your entire life. I would be remiss in not expressing the sincere heartfelt gratitude to each and every one of our esteemed panelists for participating in today's program. By doing so, you have not only honored the United Way of Southeast Louisiana, you have provided your level of expertise in sharing with our supporters and our citizens across our 7-parish region your commitment to making sure they know some of the critical issues that will be addressed in this upcoming session. It is my sincere hope that you have found this program today to be of tremendous value to you. It is my hope that you will stay informed and engaged with the public policy activities of the United Way of Southeast Louisiana. And as you know, today is only one of a two-part series. We will be hosting our second educational session tomorrow. If you have not yet registered for that, I trust that you will do so, because tomorrow will focus on financial stability and community strengthening, extraordinarily important topics for our United Way. As I close today's program, I'd like for you to know that United Way of Southeast Louisiana is proud of our public policy team, of our advocates, and we want you to know that I hope what served as an example for you today is that we work in collaboratives. We focus our work on the expert advice and input of our subject matter experts and our team in the field. Together, we know that we can truly create equitable communities, but we must do so as a collaborative. I want to thank you for being here, and I would be remiss in not acknowledging a program like today's does not show up without the extraordinary support of Pam Allison and Mary Ann Bazil, who are in, Pam Allison's my assistant in policy and advocacy, but Mary Ann Bazil is in marketing and communications. Thank you. See you tomorrow.